Hello, I'm Mark Avery and I'm the Program Director, and I will be looking after students who come to us for learning and growth in their career and development in and around all aspects of health service management. Health service management is a wide discipline. It provides career training, education and learning for students who want to work in acute care services, hospitals, community health services, aged care services, disability care services, and a whole range of sectors or industries that support healthcare. Contracted services, consultancy services, environmental, food services. So there's a whole range of industries that support healthcare and require good leadership and management and good people who can drive and guide those businesses. So our graduate certificate programs and our master's programs in health service management prepare and give experience to students to take on roles in departments, in teams, in hospitals, in community health organisations, in ministries of health and in private companies throughout the world. When students come to Griffith, either through studying in the programs onshore here in Australia or through our hub in Singapore or through online learning throughout the world, they're very much welcome and they're very much part of a professional team and discipline who is going to enhance and enable their career directions. Students coming to us at Health Service Management at Griffith University and studying in the Australian university environment sometimes face 3 or 4 major hurdles or new ways of working and living. And at Health Service Management, we've done a number of things to support students as they arrive into the country and into our program and as they study with us over the coming months and years. English language is a really important aspect of being part of learning in universities in Australia. And so this university provides a range of support in terms of English language, in terms of editorial service. But in health service management, we've augmented that and we provide students with a package of options to have their work edited and supported so they do well in our courses. In our courses, we don't have traditional examinations. We have ongoing written assessment as our method of ensuring that students understand and grasp the material. We're not teaching English, but we need students to have a capacity to be able to express themselves and their ideas so as they do well in their courses. So we have a range of things to support. Secondly, and a big issue is there will be a change in the academic tradition that students come from and to in the Australian setting. Throughout the world, there are a number of systems that might be exam-based or focused. And here in Australia, we use a range of autonomous learning models where students need to be confident and self-directed about the way that they learn.
Yeah, and because you can access all your study material before you actually start your course, it helps you plan the entire course and your assignments so you can do a good job. So that really helps.
And so we spend a lot of time providing education on how to study, how to prepare assignments, how academic writing is done in the Australian university context, and how effective and proper use of citation and referencing is undertaken. We spend a lot of time in health service management supporting students in that academic transition. Thirdly, students are interested in a career in health management. And unlike vocational degrees where you may train to be a doctor, a dentist, a nurse, an allied health professional, and therefore your job is very much styled to the vocational degree that you've undertaken. In health service management, you're prepared and you are able to work in a range of careers. And so we give students a whole range of strategies on how they can go about getting jobs in Australia or internationally, and to use a new way and a new thought process in thinking about securing a career that they're happy with. And lastly, we spend a lot of time ensuring that our students in health management are safe and secure and come into learning in this country in a way that is sustainable for that period of time. Different cultures, different systems, different lifestyles can be quite confronting and isolating to some students, and we spend a lot of time protecting and nurturing and supporting students.
The way the health service management family I will call them a family. They just took us, embedded us into them. It was a seamless transition. They have been always available with us. I mean, you say Mark, Ian, Lawrence, Richard, anyone, they're so contactable. You just send them a mail, book an appointment with them. They're there with us always.
After the first month, everything was fine. I also realized that if I have any other problems, I could always go to my lecturers and ask for further clarifications. Or if I feel like I'm a little bit behind, I can ask for extensions. They're very helping and very welcoming.
The health service management programs that students will undertake with us have been structured in a way that there is enormous choice for students, so they can align what they're learning in our programs to where they see their career going or where they want their career to be going.
I wouldn't call it studying. I would say it is learning redefined. It is something, it's an experience.
So choice around particular areas of study, informatics, leadership, strategic development, particular functions around project management, around learning styles, around workforce management are all major parts of the program that the student can elect to mix and match within the recipe, if you like, of a good health service management degree. So students should come thinking about what they want to do in the next stage of their career so that they tailor their studies here at Griffith to be supportive of that. We welcome everyone at the beginning of the semester at a dedicated and quite long orientation session for students starting with us in health service management. It's very important that all students arrive for orientation. I understand that there will be issues around visas and securing air flights and tickets and other arrangements to come to the country, but it's critical that students arrive on the orientation week, which is the week preceding when teaching starts at Griffith.
And I really benefited from the orientation week in terms of getting to know the stuff that I'm going to learn.
It tells you of all the resources that are offered in the university and in HSM. You can access English help, academic advisors. All these are necessary for you to help you go through your studies.
Students in our 2-year program and students who elect a part of the 1.5-year program can actually complete health service management work integration learning. And this is an internship placement in the field of health service management in acute services, aged care services and the other sectors that make up health. It's great for experiential learning and adding to a student's curriculum vitae or resume about practice and experience that they've had. The university requires when students go on their work integrated learning placement to have a number of important things in place, and one of them is a very up-to-date vaccination record. So students should come to the country and bring with them all of their current vaccination records that may be held at home or maybe at places of work that they've had or where they've studied in their undergraduate degree. Other than that, everything else is taken care of in orientation here at Griffith, and we look forward to welcoming students into orientation, into Australia and here at Griffith in health service management.